Hi everybody, Dr. Cary Yurkiw here. Thank you for joining me today for rotator cuff level 1 stretches. Sometimes people refer to this as shoulder injuries. It's the rotator cuff, the four muscles that come out of the back part of the shoulder, wrap around into the front through a tendon. And this is common conditions that we see in the clinic. So I'm going to show you the anatomy of the shoulder, and then we're going to get into what we can do to help you with that. So the first thing is the rotator cuff is the four muscles that are on top of the scapula and underneath it that wrap around to the front part of the shoulder. Sometimes what we see is pinching in the front part where that person's thumb is. Sometimes we see pinching in the back part where the muscles are coming together to wrap around into the tendon going to the front. So this is a very common location for pain in the shoulder, and the anatomy of it looks like this, where what we see is the muscles coming together to form a tendon, then wrapping around into the front of the shoulder, and then that's where the insertion happens right next to the bicep muscle. Now for stretches, just going to show you some level 1 stretches today. I like this one, the scapular range of motion. If you roll your shoulder up, forward, the dotted line shows you where you should go to. Then backwards, that's the next step, like that, and then down. This will mobilize the shoulder and help the scapula with its range of motion. I would do 10 rotations backwards and 10 rotations forward each day. And this is with the help of a health professional. If you're my patient, then I'm sending you this as a instruction sheet. If you're not my patient, then talk to your health professional before you start anything new. I do like this exercise right here. You could use a dowel or a rod or even the broomstick. You want to hold the broomstick down and then lift your arms up together to about 75% of the range of motion, maybe 80%. And that's going to help with the range of motion and stretch the back muscles here in the rotator cuff without too much risk of pinching that tendon in the ball and socket. I wouldn't do B. We'll talk about that for level 2. I wouldn't do C right now either. But I do like this one right here, these isometrics. So with standing next to a door frame, you can push your arm outward against the door frame and just hold that. Now initially I would use light pressure, and I would only have this at about a 45-degree angle, so not fully rotated outward, so halfway with the arm, and then push against the door frame, hold for 3 to 5 seconds and relax. Do this 5 times. And then what you can do is the opposite. Pull in against the door frame. You can start at that same position at about 45 degrees and kind of pull in. You can start a little bit closer to your body like this at 90 degrees as well and pull in. And that's going to work the opposite muscles to get you a little more flexibility and a little more strength and stability in the shoulder. We won't talk about tubing right now. That'll be level 2. And this one I like to do on a table or a surface where you can have your arms hanging down and then lifting up, but we won't talk about that today either. That'll be level 2, and sometimes with some weight it'll be level 3 as well. So for level 1, this one, scapular range of motion, A with the dowel up over your head, and A and B for isometrics, and that's pretty good for a start for the shoulder. I would do these exercises each day and have your healthcare professional monitoring your progress. I would stop if there's any sharp pain, ease up because it's causing pinching or pressure on the nerve or the tissues. If you feel a pulling or a slight burning, that's okay, but if it becomes very intense, I would stop and let your health professional know. So I want to thank you guys for joining me today as I went over these rotator cuff exercises, level 1, and then I look forward to doing the next video for you, level 2, and then level 3.